First, some good news.
Overnight, we had 8 cases of local community transmission. We're deeply grateful that people not only are listening to the restrictions in place, not only adhering to the advice we're providing, but they're also coming out in droves to get tested.
Then Sydney's hopes for an unrestricted Christmas were dashed, for some more than others.
Over the next few days, there will be modest changes to restrictions over the Christmas period. We appreciate what a difficult time this is for everybody across the state.
If you live in Greater Sydney, on the 24th, 25th and 26th of December, you can have 10 people in your home, with the family-friendly addition of unlimited kids under 12.
Can I stress, you cannot have different groups of 10 people during the day. It's one group of 10 and you have to stick to that one group of 10, plus kids under 12.
But for those in outbreak epicentre, the Northern Beaches, there are 2 sets of rules for Chrissy.
If you are a resident of the northern part of the Northern Beaches, if you are a resident that lives north of the Narrabeen Bridge and east of the Baha Temple at Mona Vale Road, you cannot leave your area. You are still in lockdown.
But on the 24th, 25th and 26th, residents of the Northern Beaches can have 5 guests in their home as long as they're from within the same lockdown region. If you live in the southern part of Sydney's Northern Beaches, things are a little more flexible. On the 24th, 25th and 26th, you'll be able to have 10 people over, but you have to stay in your area.
You can have other people come in from the region or from other parts of Greater Sydney, but you yourself can't leave. We don't want people from the Northern Beaches mingling in other parts of Sydney.
So it's mostly more lockdown for Sydney's epicentre suburbs. But is a restricted Christmas a small price to pay to get COVID back under control? Well, to help us answer that question, we're talking to New South Wales Health Minister Brad Hazzard. Minister, thank you for joining us on what I know is a very busy day. We can see that those case numbers are coming down to around about a similar level to what they were back in July or August in New South Wales when things were much more relaxed. So if those case numbers stay below 10, how long would you keep the Northern Beaches locked down?
Look, the issue is not just about the numbers, Lisa. It's whether or not they're part of the known cluster, because that tells us that we're following the lines of transmission. But at the moment, it's looking pretty positive. We've got 97 cases up to this evening. I'd say we feel positive, but we're also still on high alert, which is why we've imposed some restrictions that won't please everybody, but still tried to strike the balance for Christmas.
So you're expecting that lockdown to continue to New Year's Eve?
Well, I'm not sure about that. I think that we need to review it. What we will do is we will review it as soon as the 3 days that we've designated, if you like, as the Christmas period. So straight after Boxing Day, Crisis Cabinet will discuss those issues and just see where we're heading. But the main thing is to take the advice from Dr. Chant and the public health team here in New South Wales.
So can I ask about one of the restrictions that was announced today, or perhaps alleviations that was announced, and that is this exception for those in the southern part of the Northern Beaches. Over Christmas, they can have people come to their home from all over Sydney, but they themselves are not allowed to leave their area. How is that any different from them going to all the places that the other people are from?
Look, we discussed that at great length with Dr. Chant and her team. Effectively what we're trying to do, as we have all the way along, and other governments have done, or particularly Victoria, trying to strike a balance. And what we're saying here is if we've got people coming in from outside and going to go principally to people's homes, then at least we know what's happening there. And they're not going to be in huge numbers, I wouldn't have thought, coming in and bursting around the various parts of the Northern Beaches. But if we open up the Northern Beaches, even that southern area, to allow people to go out, I would imagine, and we have decided that there probably would be quite a few people who would bolt to the pubs and the clubs across Sydney, and that's probably not a good thing for us at the present time. And we know we do still have we believe there's still some possible cases that could lead to transmission in that southern end. So nothing's perfect in this. There's no rule book, but it's the best we can do for the time being. And I appreciate that some people might say that's not good enough, but you know what? It's what we decided, and we hope that it strikes the right balance.
How are you planning to police the borders around the Northern Beaches over this time?
Certainly the most crucial part for us is that northern area of the Northern Beaches local government area. And there will be police on the various in and out roads, and essentially there's only about three and a bit, I suppose, a small well, I won't give away how you get in and out, but there are 3 areas where we're going to have police, and they will be very active. I'll just say that. But it's people have challenged every decision. In fact, I heard Peter Hellier. I came home one night and I heard him saying months ago, "Why is everybody trying to find ways around this? Just accept the fact that we're in a 1 in 100-year pandemic and accept it and move forward." And so far, that's worked in New South Wales. And so I thank Peter for his advice to everybody.
This is just softening up the hardest hitting person on the panel. That's all this is.
Well played, Minister. That's why 35,000 Sydney-siders are getting tested, and I take all credit for that, Minister.
Well, meanwhile, Pete for PM. Minister, the Premier announced today mandatory New South Wales government QR codes for all venues from January 1st, as opposed to what's been going on over the last 6 months, which is pretty messy and venues basically working it out for themselves, which by your own admission has led to people putting down false names, incorrect phone numbers. Why didn't you introduce this mandatory QR code 6 months ago?
We did. But what we're saying now, I mean, go back a step. QR codes in New South Wales have been mandatory for a long, long time in most settings. But of course, the problem really is that there's been a whole lot of companies that realise, well, I can make a QR code platform. And so various cafes and restaurants chose an array of different companies to do it. What the traces, and these are the gold standard traces that we have here in New South Wales, they are telling us that sometimes when they ask a coffee shop, for example, can you give us the data, quite often the proprietor of the business hasn't actually got even a knowledge of how to access the business that they've actually employed with them to give them the QR codes. And so it can take hours. And 4 hours or 5 hours or a day to get the information can mean a lot more people getting the virus. So we need to do it as quickly as possible. We've decided that we'll move to a compulsory now QR code with Service New South Wales. And we think it will make that difference. And certainly the tracers, those health people who work through the night, they don't need to have 4 or 5 hour delays in getting the data. So we think that'll be far better.
Minister, thank you very much for your time tonight.
It's a pleasure, Well, and thank you to the guys. Thank you very much.